at least where I am. And let's go ahead and get started with clinical pathology, is where I left off. For the 14th. Oh my goodness, that's far behind. Okay, whatever. So we talked about collecting samples of like blood. We talked about things that can happen if you collect it wrong, and we talked about the different kinds of tubes used. So the first tube is a serum tube. It's also called a clot tube or a red top tube because it's got a red top. There's no anticoagulant added to that. It doesn't have anything in it. The blood is going to clot, and once it's done clotting, there's going to be serum on top, and you just let it sit for like 20 minutes. If you put it on a heat block, it's going to speed up clotting, and then you can spin down the clot and transfer the serum to another tube for testing. That's, this tube's very important for whenever you're using CBC, which is complete blood count chemistry. So, yes. All right. If you spin it too quickly, there's going to be a gel on top and no serum. You always want to examine for serum quality. There could be lipemia, hemolysis, or icterus in the serum if it was collected wrong. And you need to separate the serum because the cells keep metabolizing if you don't. And hemolysis is going to develop over time, or could develop over time, which could ruin the sample. So another type of tube, not used much anymore, but it's called a serum separator tube, also called a tiger-topped tube, because it's got like a sort of camouflage-looking top. The blood's going to clot again, and it's pretty much the same use as a serum tube, just saves a step. All right. There's certain testing where you just need to call the lab because your tube isn't going to be good enough. Like endocrine, drug, or heavy metal testing, it's better to just call the lab if you don't have the necessary equipment. Next is an EDTA tube. Also called a purple top tube. It's called EDTA because it's ethylene diamine tetraacetic acid. That's a big word. But it binds calcium, which works as an anticoagulant. The binding does, because otherwise it binds, or otherwise the calcium works and the blood coagulates, which is not what you want in this case. But you want to avoid clotting, so do it quick. Whenever you're using the EDTA tube, you want to be quick, sort of. You got to get a good blood draw and then fill the EDTA tube first. And you don't want to do hemolysis. You don't want to accidentally hemolyze the blood. So don't be too fast, like shooting the blood into the tube. You don't want to be too quick with that because you can hemolyze the blood if you shoot it out too fast, especially if you're shooting it out of something like a 22 gauge needle. Not good. And then you need to choose the appropriate tube size. These EDTA tubes come in different sizes, and each size has its own amount of EDTA in it, which is the stuff that binds the calcium. If you put not enough blood into, a big tube, then you're going to have too much EDTA. Not good. If you put too much blood into a smaller tube, that's not enough EDTA, and then your blood's going to clot. So you use this with CBC and cytology. So again, you don't want the blood to clot, and you don't want the blood to hemolyze if you're going to use this tube. So you're going to want to mix the blood gently before you use it, because that's going to get that EDTA mixed with that calcium, which prevents the clotting. Horses, and then, species dependent. This is how fast the cells will settle in the tube. Horses, their blood cells are going to settle the quickest. Like you're gonna see the what's it called, packed cell volume, the cells themselves, the red cells themselves, sink to the bottom quickest, and the plasma is going to go to the top, that sort of thing. Dogs and cats are next, and then cattle is last. Again, you don't want the blood to clot. I can't really emphasize that enough. It's going to mess up the results, and it can also clog and ruin your hematology analyzer. Not good. So plasma, you can collect plasma from this because the blood's not clotted. Plasma is the liquid that separates from unclotted blood, and serum is the liquid that separates from clotted blood. And some important distinctions in this are that serum lacks fibrinogen and some coagulation factors. That's what makes it different from plasma. So plasma can be used for some chemistries, but obviously not calcium chemistries, because this is EDTA, and calcium is going to be bound. There's not going to be any calcium in there. Not electrolytes either, because potassium is going to increase as a result of this test. That's just a side effect. And then not enzymes either, because some of those enzymes depend on calcium, and they're just going to be low as a result because there's no calcium. All right, moving on. So, calcium deficiency. So, if an animal's deficient in calcium, it varies their response to that. So, cows and horses, large animals, right? These are 1,000-pound sometimes animals. And so when they get calcium deficiency, some signs of that are going to be, they're just going to be weak, and they're going to collapse. They're going to go down. That's what they call a down cow or something like that. Lighter animals like dogs and cats are just going to develop something called eclampsia. Okay, the next tube we're going to talk about is the heparin tube. It's got a green top, okay? It has an anticoagulant in it called heparin, and it works by activating antithrombin. Antithrombin is a natural anticoagulant in the blood, and it kind of works with clumping the platelets. Platelets are very important for blood coagulation. If you have a low platelet count, then it's a lot easier for you to bleed, and especially a lot easier for you to bleed out. Not a good thing. You want to handle these heparin tubes similar to EDTA, because this is also an anticoagulant. But what that means is you've got to avoid hemolysis and clot formation with these. Now, for the uses for heparin tubes, these are going to be used for quick chemistry results if you need it quick, because you don't have to wait for a clot to form, and you can use them for the full chemistry profile. You can also use these in avian, which means birds, or exotics. You can use these for their CBCs, because if you were to use an EDTA, that for some of those animals it will induce hemolysis, which isn't good. It's not good for whenever you're trying to test these cells. And the heparin tube is the only tube that doesn't bind calcium. So that's important to know. Next is the citrate tube. It's got a blue top. Okay, it has an anticoagulant in it called citrate. This binds calcium, but it loosely binds calcium. So this is usually a reversible anticoagulant. You would handle this the same as you would handle EDTA. Again, you want to avoid clotting, avoid hemolysis. But it's more important to fill this completely because there's a small amount of liquid at the bottom, and the ratio is important. There's a larger volume of anticoagulant in this. You would use this in hemostasis testing, and it's good to know the loose binding of these calcium ions. I can't read that. I'm just going to skip over that. It's like something I'm not a term. Okay, anyway. Next is the fluoride tube, also called the gray top tube. It has an anticoagulant in it called oxalate. So this is kind of interesting because this has a lot to do with the diets we eat as well. Oxalate chelates calcium, which means it binds calcium. And this certain tube also has sodium fluoride in it, which that fluoride inhibits cell metabolism, glycolysis. So if you were to eat a high oxalate diet, you are going to end up having less calcium. And so if you're calcium deficient, maybe it's because you're eating a high oxalate diet. So stop eating the oxalates and you'll be better. That's the simple fix. Pretty much all diseases are caused by toxins. Whether it be oxalates. I mean, it's not conventional to say that, because a lot of doctors will say, oh, just treat it with this medication or that medication. Just take this pill for the rest of your life. But pills and treatments are just that, treatments, right? They're not cures. So what is the cure? Well, removing the thing that's causing the problem in the first place is the cure. Okay. These fluoride tubes are not common either. There's another tube called an activated clotting time tube. It's another gray topped tube. It has no anticoagulant, but it does contain diatomaceous earth. So whenever you're handling this, you want to make sure it's filled and kept warm. And then you're going, the use for this is to evaluate coagulation. So the whole purpose is to measure, or the whole purpose is to see the blood clot. So you measure the time to clot formation. You like invert the tube every couple of seconds, and yeah, that's the whole point of the tube. You want the blood to coagulate. You can use this in clinic if you don't have hemostasis testing. And this is also good whenever you're trying to detect rodenticide poisoning, which is rat poisoning, right? If your dog or cat accidentally eats rat poison, this is one of the cases you'd use this too. If you're trying to make sure, oh, did they eat that poison or not? Probably a good idea to find that out. Hey, Jordan, how are you doing today? Hey, Hunter. Hey, pro mobile computer expert. How are you doing? So, whenever you're collecting blood, you want to do a quick and clean blood draw. You don't want to make it messy. I know some people that have gone to a phlebotomist, or they've gone to the doctor to get their blood drawn, tested, or whatever. And they'll describe it. Oh my goodness, those phlebotomists are like just digging in there and ugh. First of all, that hurts. Second of all, that's going to cause collapsed veins. And goodness gracious, it just sucks. Hey, Michaela, how are you doing? You want to. It's most common to collect blood directly from the vein. All right, see you later. And then correct blood directly from the vein, that's the most common form of blood collection in both animals and humans. And of course, if there's a larger vein, you'd have a faster blood collection. For example, the jugular vein is commonly used in dogs, as well as the cephalic vein in dogs. Cephalic is more common, but it doesn't collect blood as fast. However, you can also collect blood from a catheter. So if you've already got a catheter in the vein, it's a good idea to collect it from the catheter because that preserves the veins. There's not going to be as much risk of collapsed veins, stuff like that. We talked a little bit about this earlier, but there's potential problems whenever you're collecting blood. The blood can be, the plasma can be icteric, hemolyzed, or lipemic. So it can be yellow as a result of increased levels of bilirubin, which is usually due to liver disease, and that tells you something. It can be hemolyzed because you collected it wrong, because maybe you put the blood into the tube too quick. Or the blood can display lipemia, which is fat in the plasma. This usually happens due to the patient not fasting before the blood draw, or sometimes it's just a genetic thing. Sometimes the animal just has problems with that. Hey, how are you doing? It's good to see you again. Okay, and so there's general test characteristics. We talked a lot about this in epidemiology last semester, but there's sensitivity, specificity, precision or reproducibility, and then accuracy. What do you mean? I've seen you on my stream before, so it's as simple as that. But that was a couple months ago that we talked about sensitivity, specificity, all that. All right, so there can be dichotomous test results, like yes or no, positive or negative, or continuous test results. And continuous test results are usually a number. Sensitivity is the ability to detect disease in an affected animal. So if a test is highly sensitive, that means if you get a positive on that test, you can be a little bit more confident that this animal's diseased. Now, specificity is the ability of a test to detect a non-affected animal. So in the case of a highly specific test, if you were to get a positive, you'd want to do more tests. You wouldn't have a lot of confidence in that test. Now, if the specific test is negative, then you'd be like, okay, this is a I can put trust in this test. Do I have a Kahoot for you? No, I don't have one today. Sorry. Specificity. There are many enzymes measured on the chemistry profile. ALT, which is found mostly in hepatocytes, CK, which is mostly found in muscle cells, and then AST, which is found in both muscle cells and hepatocytes. So if you were to have a high ALT, then that test that you tested to, or that you did to find out that the ALT is high, is specific for hepatocyte injury. If you had a high CK, it's specific for muscle cell injury. But if you have a high AST, then both are high. You don't know whether it's a muscle or a hepatocyte injury. So in lab tests, there can also be specificity. If something can only be caused by a few things, we say it's more specific. If it can be caused by many different things, then we'd say it's non-specific, and that can be subjective. Take-home message is, if a test is highly specific, then a positive test would make it very likely the patient has disease, or the disease being considered. If a test is poorly specific, with a positive test, you may still need to consider other possibilities. Okay, and that was all on that day for clinical pathology. Moving on to comparative anatomy. No. Hey, Frederick. Good to see you again. Okay, what was the 14th? That was a Wednesday. Thursday. Hey, Frederick. Yeah, I don't think... well, I guess that was it for the 14th. I mean, I didn't see much else there. Okay, I'm going to end this stream. I'll be back in a bit, though. I'm just going to take a short break. Thank you all for watching, and see you next time. See you in a bit, Frederick.